Hey, welcome. Good afternoon, everyone. My name is Alicia Rice, and I'm the program manager here on the training and education team at MaineHealth Center for Tobacco Independence. I'd like to welcome you to our ongoing webinar series, one part of our comprehensive tobacco treatment and prevention education program. It's offered on behalf of the Maine Center for Disease Control and Prevention, Department of Health and Human Services. Today's session will be recorded and it will be posted on our website following the presentation. We are offering one CME credit and one CHES credit for participants who attend the full live session. To receive CMEs, you must have a Cloud CME profile, and credits will be available in your profile within a week of this webinar. Instructions for creating a profile, if needed, will be included in the post-webinar email that will go out today. For those collecting CHES credits, your attendance will be submitted to NCHEC after the event on your behalf. Please note that only participants who registered, joined via the Zoom link, and attended the entire session are eligible to receive CMEs and CEUs. And at the end of today's webinar, an evaluation will appear on your screen and will also be emailed within 24 hours. We do ask for your feedback. It's extremely valuable to us, to our presenters, and we do appreciate you taking a few minutes of your time to complete it. So before we begin, we do just have a few housekeeping notes. All attendees are on mute to minimize background noise. The raise hand feature is disabled. If you are interested in a more interactive learning opportunity, we do encourage you to participate in one of our core trainings that we do offer. You may also submit questions at any time using the Q&A box. We will address as many questions as time allows, and any unanswered questions will be collected and addressed in a follow-up email. Also in the follow-up email, you will receive a copy of the presentation slides after today's session. And the chat box is also disabled, so please use the Q&A box for any questions. So today's webinar, Youth Tobacco and Nicotine Use in Maine, Insights from the 2025 Maine Integrated Youth Health Survey, and it's presented by Bonnie Elper of MaineHealth. Let's see. Bonnie is a tobacco treatment and prevention educator with MaineHealth Center for Tobacco Independence. She shares knowledge about the best practiced, evidence-based methods for helping people successfully quit smoking, vaping, and using other nicotine products. She is a certified tobacco treatment specialist through the American Heart Association and is credentialed as a master certified health education specialist. In addition to tobacco treatment, Bonnie has expertise in health literacy, patient-centered communication, and teach back. And in her free time, she enjoys exploring the coast of Maine with her dogs, traveling with her husband, cooking, yoga, pottery, and gardening. And we also have a guest, and I know, Bonnie, you are introducing her in a moment. At this time, I'd like to turn it over to Bonnie.
Wonderful. Thank you so much, Alicia. And hello, everybody on the call. Thank you so much for joining us today. I think it's lunchtime for people here in Maine. I don't know if we have non-Mainers on, but thank you for spending lunchtime with us. Today, we'll be reviewing some insights from the 2025 Maine Integrated Youth Health Survey, which is also referred to as the MIAS. So you'll hear us say that a few times. And I'm pleased to share that we are joined today by Haley Pulowski. She's the MIAS coordinator, and she has agreed to help us answer any questions that come up throughout the presentation about the MIAS results. So thank you so much, Haley. Thank you for being here. And as Alicia mentioned, we encourage you to type any questions that you have into the Q&A box, and we'll use whatever time we have at the end of the webinar today to go through those questions. And like we mentioned, if we don't have time to get to everybody's questions, we will follow up and share some answers. So before we dive into the topic today, I just have a few of our standard CTI slides to review with you. The MaineHealth Center for Tobacco Independence has worked across the state of Maine since the year 2000. We address tobacco use and exposure through education, prevention, policy, treatment, and training initiatives. Our key program focuses include tobacco treatment services, our training and technical assistance center, and health system change strategies. And we're also proud to be nationally accredited by the Council of Tobacco Treatment Training Programs. As we gather together in this place, we want to acknowledge that we are occupying the traditional territory and ancestral lands of the Wabanaki people, who for thousands of years have called this place home. We acknowledge their continued connection to this land, give thanks for allowing us to do this good work on their homeland, and remember their ancestors who were here before us. Please note that all references to tobacco in this presentation refer to commercial tobacco use and not the sacred traditional tobacco used by Indigenous communities. All planners, faculty, and others in control of this educational activity have no relevant financial relationships with ineligible entities. Okay, so these are the objectives for today's webinar. We will take a look at some of the key findings related to youth tobacco and nicotine use from the 2025 Maine Integrated Youth Health Survey. We will identify the most commonly used tobacco and nicotine products among students here in Maine. And we will demonstrate how to offer support and refer youth to evidence-based programs, including My Life, My Quit and the Maine Quit Link. Okay, so let's get started. The Maine Integrated Youth Health Survey is the state of Maine's anonymous, biennial, voluntary school-based survey that measures adolescent health risk behaviors and experiences. The survey is completed by students in grades 5 through 12, and all public and quasi-public schools in Maine are invited to participate in the survey. So the MIAS is conducted by the Maine CDC in partnership with the Department of Education. The survey covers topics such as mental health, substance use, nutrition, physical activity, tobacco use, school safety, and protective factors. The data collected helps communities, schools, and policymakers to better understand the challenges and experiences that young people face. They also use this data to identify different trends over time. By highlighting risk factors and protective factors, the MIAS plays a key role in shaping programs and policies that support healthier, safer environments for Maine's youth. And there's a lot of great data in each of these reports, and I do encourage you to take a look at some point, read through them, check out the other topics that you might be interested in. But for the purpose of today's webinar, we will be sharing the 2025 survey results just from the tobacco section. And a heads up that we will be reviewing a lot of data today, moving at a pretty quick pace, but you will get a copy of these slides after the webinar. So rest assured, you don't have to take notes, you don't have to write anything down. You'll have all of this at your disposal so you can review it again. So to start, let's take a look at this survey question that asks about current use of all nicotine and tobacco products. This graph shows us the percentage of students who have used any kind of tobacco product at least once during the past 30 days. So this includes cigarettes, cigars, electronic vapor products with nicotine, chewing tobacco, snuff, dip, or dissolvable tobacco products, excuse me. So we can see that the percentage gets higher for each grade. The 7th grade percentage is at 2.9%, which indicates that just about 3 out of every 100 students in that grade are using a nicotine or tobacco product. The numbers do increase once students enter high school, and the seniors in high school reported more use. So more than 2 out of every 10 high school seniors are using a tobacco or a nicotine product. This slide shows us results from the question on the previous slide, but we can see the answers from each county where data is publicly available within the state of Maine. MaineHealth has a participation threshold of 50%, so that's schools by students in a county, in order to release the data. Maine is divided into 16 counties. The southern and coastal counties, such as Cumberland, York, and Sagadahoc, do have higher population densities, more diverse economies, and they tend to have more available and accessible services. So that's down in this area, if you can see where my mouse is circling. And in contrast, our northern and more inland counties, including Aroostook, Piscataquis, and Somerset, they're more rural and they have fewer people who live there, and they have fewer large population centers. So if you're somebody who lives or works in one of these counties, take a look, see how those numbers compare to the other counties in the state. And just a quick note here that there are a few data points that are not available based on small cell sizes, or the data is not shown due to low response rate, excuse me. So we can see that Washington County and Franklin County reported the highest rate of high schoolers who have used a tobacco or nicotine product at least once in the past 30 days. And in contrast, Cumberland County has the lowest reported high school rates. None of these counties are significantly different than the state levels. And for middle school, Waldo County reported a significantly higher rate than the state, while Lincoln County reported a significantly lower rate than the state. And this slide shows us the current use of popular products among high school students here in the state of Maine. Of students who reported using a tobacco or nicotine product within the past 30 days, this shows us how those products were represented. Electronic vapor products were the most popular product that was reported at 13%. And next were the other smokeless products with a 5.2% use rate. So that includes nicotine pouches, brands like Zyn and On, as well as chewing tobacco, snuff, dip, snus, and dissolvable tobacco products. And those brands include Copenhagen, Grizzly, Skoal, Camel Snus, and the Velo nicotine lozenges. Over here in the third column, we can see that cigarettes are used by 5.1% of high school students, and 3.7% reported use of other smoked products, which include cigars, little cigars, cigarillos with brands such as Swisher Sweets, Middleton's Black and Mild, and Backwoods. So I'm going to use this information and divvy up the survey results in different sections. So we'll start out with electronic vapor products first, then we'll move on to other smokeless products, followed by cigarettes, and we'll wrap up with other smoked products. So before we dive into the MaineHealth survey questions about electronic vapor products, I do just want to share a quick overview about what these are. And disclaimer, the info on this slide is not pulled directly from the MaineHealth survey data. As we learned on the previous slide, these are reportedly the most commonly used product by high school students here in Maine. You may also hear these called EVPs, vapes, electronic cigarettes, or e-cigarettes. And for the purposes of today's presentation, I'll be saying electronic vapor products, or EVPs, to stay aligned with the language that is used in that MaineHealth survey. So electronic vapor products are devices that heat a liquid into an aerosol vapor that is inhaled. The liquid often contains nicotine, flavorings, and other chemicals. Many teens are drawn to these EVPs because of the youth-targeted marketing campaigns, the variety of flavors and bright colored packaging, as well as peer pressure, social influence, and the misperception that it helps to deal with stress. In Maine, the average retail cost is between $14 and $18, and popular brands include the Elf Bar, Juul, and Views. While overall use rates are declining compared to previous years, disposable EVPs with high nicotine content continue to be widely used. So this survey question asked students in grades 5 through 12 if they have ever used an electronic vapor product. And we can see the responses here divided by each grade. And I was surprised to see that students in as low as 5th grade are using EVPs. And on average, those 5th grade students are usually around 10 or 11 years old. So this suggests that young people are exploring nicotine at a very young age. The percentages increase for each grade, and we can see that more than 3 out of every 10 high school seniors have used an electronic vapor product based on these 2025 survey results. Students in grades 5 through 12 were asked during the past 30 days on how many days did you use an electronic vapor product. This slide shows us the percentage of students who answered that they've used an EVP at least one day during the past 30 days. So we consider that to be current or recent use. While these percentages are lower than the answers for the question of if they've ever used an EVP, this is important for us to know their recent use, their current use, so it can help us to tailor our interactions with these students. And here's a look at the survey results for the previous question divided by county. High school students in Franklin County have a significantly higher rate of using an EVP at least once in the past 30 days compared to the state level. Middle school students in Piscataquis County reported the highest rate, and it is significantly higher than the state. Androscoggin and Cumberland counties reported the lowest high school rates, both at 11.7%, and the lowest reported middle school rate is in Saginaw County. This slide provides some comparison data from previous survey years. So the top 2 lines, those shades of orange, these ones here, those show us the high school data. So we can see the rates for high schoolers who have ever used an electronic vapor product, and we call that lifetime usage. And we can also see the rates for high schoolers who've reported use within the past 30 days. And remember, we call that current usage. The bottom line in shades of blue, those show us the rates of middle schoolers who have ever used an electronic vapor product, right, that lifetime usage, as well as middle school students who reported use of an EVP within the past 30 days, that current usage. So all of the 2025 data points are trending down from what we see as the peak in 2019, and they are significantly lower than 2023. But these numbers are still higher than we would ideally like them to be. Right? Of course, progress is being made, but we know that there's still work to be done to get those numbers even lower. There was a survey question that asked 5th and 6th graders, do you think that you will try an electronic vapor product soon? This slide shows us the percentage of students who answered either I definitely will, I probably will, or I probably will not. So in other words, it shows us the percentage of students who answered anything except for I definitely will not. So we can see that about 12 out of every 100 5th and 6th grade students are at least considering thinking about trying an electronic vapor product soon. So a little over 1 in 10 students, it's on their radar. They're thinking about it. This survey question asked students in 7th through 12th grade, how wrong do you think it is for someone your age to use electronic vapor products? And this slide shows us the percentage of students who answered either a little bit wrong or not wrong at all. And this survey question asked, how much do you think people risk harming themselves physically or in other ways if they use electronic vapor products every day? This slide shows us the percentage of students who answered either no risk or slight risk. So this slide and the previous slide indicate to us that there is a misperception among these students that EVPs do not pose a health risk. Okay. This survey question asked middle and high school students, the last time you used an electronic vapor product, what was in the vapor that you inhaled? So among those who have used an EVP, this slide shows us the percentage of students who answered each option. So we can see that nicotine is the most common response. More than 50% of students chose that one. 18.3% of middle schoolers and 28.6% of high schoolers reported that their EVP contains marijuana, THC, or hash oil. And just as a note here, the Maya survey questions use the term marijuana. However, cannabis is now the legal term used here in Maine. Let's see, 11.3% of middle school students and 6.6% of high school students reported that their EVP contained just flavoring. And 19.7% of middle schoolers and 9.3% of high schoolers were not sure about what was in the vapor that they inhaled. This next survey question asked, during the past 30 days, what flavor of electronic vapor product did you use most often? And they were instructed to only select one response. So among the students that have used an EVP during the past 30 days, this slide shows us the percentage of students who reported each flavor. 3.3% of middle and high school students selected the alcoholic drink flavor, and that includes wine, margarita, or other cocktails. 5.6% of middle school students and 3.8% of high schoolers selected chocolate, candy, desserts, or other sweets as their flavor. Fruit flavor is the most popular, with 58.4% of middle school and 48.6% of high schoolers selecting this option. 5.3% of middle schoolers and 18.6% of high schoolers chose menthol as their flavor. 7.2% of middle schoolers and 6.5% of high schoolers selected mint. Tobacco flavor was only indicated by 4.4% of middle schoolers and 2.8% of high schoolers. And the category some other flavor was the option selected by 15.8% of middle schoolers and 16.4% of high schoolers. So they're using a flavor that was not included in this list. This survey question asked, if you wanted to get electronic vapor products, how easy would it be for you to get some? This slide shows us the percentage of students who answered sort of easy or very easy. And keep in mind here that the legal age to buy tobacco and nicotine products in the state of Maine is 21 years old, and that does include EVPs. And however, we do see that more than 40% of high school students reported that they could acquire EVPs if they wanted to. So we will explore this a little bit further on the next slide as well. This survey question asked high school students during the past 30 days, how did you usually get your electronic vapor products? And they were instructed to select only one response. Among students who have used EVPs in the past 30 days, this slide shows us the percentage of students who got them from each source. So more than half of them acquired them from a friend, a family member, or somebody else in their life. 5% bought the EVP from a vape shop or tobacco shop. 3% bought the EVP at a convenience store, a supermarket, discount store, or gas station. 0.9% bought them at a mall or a shopping center kiosk or stand. 3.4% bought them on the internet, such as from the product website, a vape store website, or another website like eBay, Amazon, Facebook Marketplace, or Craigslist. 4.4% took the EVP from a store or from another person. And 32.6% indicated that they acquired their EVP in some other way. And again, I do want to highlight that it is illegal for people under the age of 21 to purchase these products. And it is the law to verify ID and ensure that the person buying the product is old enough. So there's a little bit of a disconnect there. And on a different note, this survey question asked about quit attempts. High schoolers were asked, during the past 12 months, did you ever try to quit using electronic vapor products? Among those who have used an EVP during the past 12 months, this slide shows us the percentage of students who answered yes. So ninth grade has the highest percentage of students who have made a quit attempt within the past 12 months. And I'm encouraged to see that for all high schoolers, more than 50% of them who currently use an EVP have made a quit attempt in the past year. That's encouraging. We can see those results from the same question broken down by county. High school students in Hancock County reported 72.3%, which is significantly higher than the state average. All of the counties have reported quit attempt rates around 50% or higher, but noteworthy that Cumberland County does have the lowest percentage at 49%. So that does include the electronic vapor product portion. And next up, we'll be talking about the non-combustible products. Again, just a disclaimer on this what you need to know slide. This info is not pulled directly from the MAIA survey data. The non-combustible products include a variety of products such as oral nicotine pouches, chewing tobacco, snuff, and snus. Sorry, I got those two confused. So the non-combustible products are not smoked or inhaled like they would with a cigarette or electronic vapor product. Instead, these are used by putting the product in their mouth, between their gum and their cheek or lip, and the nicotine is absorbed through the oral mucosa. Nationally, we have seen an increase in youth use of oral nicotine pouches. You might hear these referred to as Zyn pouches. So Zyn is a popular brand of oral nicotine pouches. These oral nicotine pouches are discreet, smokeless, and they're harder to detect by parents and teachers. So they are, youth are drawn to them because of that, and they're also available in a variety of flavors. Here in Maine, the average cost for a tin is about $8.50. And if you are interested in learning more about oral nicotine pouches and other kinds of non-combustible products, we do have some great recorded webinars on our CTR website that I encourage you to check out. Okay, so this survey question asked about recent use of non-combustible products. The students in grades 5 through 12 were asked during the past 30 days, on how many days did you use chewing tobacco, snuff, dip, snus, dissolvable tobacco products, or nicotine pouches, such as Copenhagen, Grizzly, Skoal, Camel Snus, On, Zyn, or Velo. And they were instructed not to count any EVPs here in this response. This slide shows us the percentage of students who answered at least one day. So interestingly, the percentage of fifth graders who have used a non-combustible product, it's the same answer as for the EVP question. So both are at 1.1%. And for the rest of the grades 6 through 12, the percentages reported are lower than what we saw for EVPs. Here we can see the results from that same question shown by county. Franklin County reported the highest rate for high school current use of non-combustible products at 8.6%. Franklin County also has the highest middle school rate at 2.7%, and both are not significantly higher than the state level. Piscataquis County has the lowest high school rate of 2.9%. Hancock and Saginaw counties have the lowest middle school rate, 1.3%. And again, although lower, it's not significantly lower than the state level. Next up, we'll be talking about cigarettes. Most people are familiar with this tobacco product, so I won't spend too much time here with this description. And the disclaimer again that the info on this slide is not pulled directly from the MAIA survey data. In the past, cigarettes were the most commonly used tobacco product among all age groups, youth and adults. But in more recent years, there have been price increases as well as increased awareness of the health risks caused by smoking. So we've seen a steady, gradual decline in cigarette smoking. We know that there are about 600 ingredients in cigarettes, and when smoked, they create more than 7,000 chemicals. At least 69 of these chemicals are known carcinogens, so they're known to cause cancer. The average cost for a pack of cigarettes in Maine is about $10.50, which is higher than the national average. And it's worth noting that Maine has recently increased our state's tobacco tax, which resulted in a $2 increase per pack. This tax aims to reduce smoking rates and generate additional revenue for public health programs. And that $2 increase tax does apply to all kinds of tobacco and nicotine products that are purchased here in the state of Maine. Okay, let's take a look at the MIAS questions that are asked specifically about cigarettes. Students in grades 5 through 12 were asked if they have ever smoked a cigarette, even 1 or 2 puffs. This slide shows us the percentage of students who answered yes. So students as young as 5th grade have reported smoking a cigarette at 1.8%, and the rates do increase by grade. By the time they're a senior in high school, approximately 1 out of every 5 students have reported smoking a cigarette. And this question asks about current use. So students in grades 5 through 12 were asked during the past 30 days, on how many days did you smoke cigarettes? This slide shows us the percentage of students who answered at least 1 day of the past 30 days. We can see that it ranges from 0.7% of 5th grade students up to 6.7% of 12th graders. Here we can see the results from that same question shown by county. Washington County has the highest percentage of high school students who report current use of cigarettes, and that's at 7.4%. Androscoggin County has the lowest high school rate at 3.6%. Both are not significantly different than the state levels. Looking at the middle school numbers, we can see that Piscataquis County has the highest rate of 4%. Saginaw and Somerset counties have the lowest middle school rates, and those are tied at 0.8%. And these are not significantly different than the state levels. The survey question asked students in grades 5 through 12, do you think that you'll try a cigarette soon? And this shows us the percentage of students who answered, I definitely will, I probably will, or I probably will not. So in other words, it shows us the students who didn't answer, I definitely will not. We can see that 12% of 5th grade students indicated that they might try a cigarette soon, and this percentage does increase for each grade level. As students enter high school, 9th grade, we can see that 24.1% are considering smoking a cigarette soon. And as they near graduation, the percentage reported is up to 32.6%. We can see the results from that same question shown by county. So when asked if they think they will try a cigarette soon, the high school students in Piscataquis County reported the highest rate at 36.9%. This is not significantly different than the state. High school students in Androscoggin County reported the lowest rate of 18.7%, which is significantly lower than the state. For middle schoolers, Franklin County reported the highest percentage of 27.7%, which is significantly higher than the state. And York County reported the lowest percentage at 17.1% of middle school students who are considering trying a cigarette soon. And this is not significantly lower than the state. This survey question asked students in grades 7 through 12, how wrong do you think it is for someone your age to smoke cigarettes? This slide shows us the percentage of students who answered either a little bit wrong or not wrong at all. This question asked students in grades 7 through 12, how much do you think people risk harming themselves, either physically or in other ways, if they smoke 1 or more packs of cigarettes per day? So this slide shows us the percentage of students who answered either no risk or slight risk. So overall, we can see that about 1 in every 10 students, they don't think that there's much risk associated with smoking. This next question asked them, if one of your closest friends offered you a cigarette, would you smoke it? This slide shows us the percentage of students who answered definitely yes, or probably not. So I wanted to include this slide in particular because it provides us with information about the power of peer pressure, especially as the students move through school and reach those upper high school grades. So even though we learned on the last slide that the majority of students recognize that there are dangers associated with smoking, right? If a close friend were to offer them a cigarette, we can see the percentage of students who would consider smoking it. So this question asks about exposure to other people's cigarette smoke. So how much do you think people risk harming themselves, physically or in other ways, if they're exposed to other people's cigarette smoke? This slide shows the percentage of students who answered no risk or slight risk. We can see that approximately 1/3 of students in grades 7 through 12 don't think that there's much risk of harm when people are exposed to secondhand smoke. This next question, if you wanted to get some cigarettes, how easy would it be for you to get some? We're looking at the percentage of students who answered either sort of easy or very easy. Approximately half of the high school seniors reported that it would be sort of easy or very easy for them to acquire cigarettes if they wanted to. So although these percentages are fewer than for the lower grades, it is still surprising to see that they do have a fair amount of confidence that they could get access to cigarettes either easily or sort of easily if they wanted to. And remember, again, that legal age to buy tobacco products here in Maine is age 21. Okay, this last product category that we'll discuss today is cigars, little cigars, and cigarillos. Again, our disclaimer, the info on this slide is not pulled directly from the Maya survey data. And while traditional cigars are larger and smoked less frequently among youth, the flavored cigarillos do remain a popular product among youth because of their sweet, fruity flavors and relatively low cost. So we can see that here in Maine, the average cost for a cigarillo is between $1.25 and $1.75. And the popular brands of this type of product, we are looking at Swisher Sweets, Black and Mild, Dutch Masters, and Backwoods. So this survey question asked about recent use of cigars and cigarillos. Students were asked during the past 30 days, on how many days did you smoke cigars, cigarillos, or little cigars, such as Swisher Sweets, Middletons, Black and Mild, or Backwoods? This slide shows us the percentage of students who answered at least one day in the past 30 days. So less than 1% of 7th grade students reported current use, and those percentages do increase by grade, with about 4.4% of 12th grade students reporting that they had smoked a cigar or a cigarillo within the past 30 days. Here we can see the results from that same question shown by county. So Franklin County reported the highest percentage for high school students who have used a cigar or a cigarillo in the past 30 days. That's at 5.9%. Piscataquis County reported the lowest at 1.5%. Both of these are not significantly different than the state. For middle school rates, we see that Oxford County reported the highest at 2.2%. Somerset County reported the lowest middle school rate at 0.9%. And both of these are not significantly different than the state. So the next 7 slides that we'll be looking at together will show survey results from questions that asked about tobacco and nicotine products in general, so not a specific type of product, so just some overall. And this question asked students in grades 7 through 12, how wrong do your parents or guardians feel it would be for you to use any tobacco products? We're looking at the percentage of students who answered either a little bit wrong or not wrong at all. So although these numbers are not very high, I think it's still worth noting that there are students who believe that the adults in their home wouldn't think it would be wrong for them to use tobacco. This next question asks students in grades 7 through 12, when you go to a supermarket, a grocery store, convenience store, gas station, mini mart, how often do you see tobacco industry advertisements on signs or poster boards? And this slide shows us the percentage of students who answered a lot. So we can see that more than 25% of students in each of these grades are exposed to a lot of tobacco advertisements when they go to common locations like grocery stores and gas stations. This survey question asked high school students During the past 30 days, did anyone ever refuse to sell you any tobacco products because of your age? So among students who have tried to buy any tobacco products during the past 30 days, this slide shows us the percentage of students who answered yes. And I'm going to put a cough drop in really quick, excuse me. There's that little springtime bug going around, I think. Okay, this next survey question asked middle schoolers during the past 12 months, were you taught in any of your classes about the dangers of tobacco use? This slide shows us the percentage of students who answered yes. So we can see that more than half of the 7th and 8th grade students reported that they did receive education at school about the dangers of tobacco use. This survey question asked students in grades 7 through 12, has a doctor or somebody in a doctor's office talked to you about the danger of tobacco use in the past 12 months? Among students who have visited a doctor's office in the last 12 months, this slide shows us the percentage of students who answered yes. So it appears that most of the communication from the doctor's office is happening when the student is in their high school years, right? Grades 9 through 12. And similar to the question on the last slide, this one asked, has a dentist or someone in a dentist's office talked to you about the danger of tobacco use in the past 12 months? So among students who have visited a dentist's office in the past 12 months, we're looking at the percentage of students who answered yes. And this is the final MaiS question that we will be looking at together today. And for this question, middle and high school students were asked, during the past 12 months, did you ever try to quit using all tobacco products? Among students who reported tobacco use during the past 12 months, this slide shows us a breakdown of each response option. So the majority of middle school and high school students reported that they did not try to quit using tobacco products in the past 12 months. However, 24.2% of middle schoolers and 23.4% of high schoolers reported that they did try to quit once in the past 12 months. 6% of middle schoolers and 11% of high schoolers reportedly made 2 to 3 quit attempts within the past 12 months. 9.6% of middle schoolers and 5% of high schoolers reportedly made 4 or more quit attempts within the past 12 months. 5% of middle school students and 10.7% of high school students reported that they did not try to quit, but they have considered it or they would like to quit. So it's on their radar. It's something that they're thinking about. So when I look at this data, I do feel hopeful. Around half of the students are considering quitting or have made at least one quit attempt within the past 12 months. So we can explore this motivation with them and offer our support. We know that quitting is hard. And with adults, we know that the average number of quit attempts that somebody will make before quitting long-term is around 30 attempts. But each time they try, they are getting closer and closer to their goal. And we know that people learn something new each time they make a quit attempt. Which is a great segue into this next section where we're talking about offering support. Just a disclaimer that the rest of these slides will not be referencing any MaiS data. So to offer support, you can start off by sharing a simple 3-part message. Ask, advise, refer. And be sure to use the terms and language that young people use. So ask them straight up, do you vape? Do you smoke? Do you use ZYN pouches? And then you can say, I care about you and I care about your health. One of the best things that you can do is to cut back or quit vaping altogether. I'm here to help you make a healthy change whenever you're ready. Are you open to me sharing some resources with you today? So it can be that simple. It can just take a couple minutes. Ask, advise, refer. This is an example of an effective brief intervention. And we make a positive difference with each brief intervention. Every time we ask, advise, and refer, we are helping to move their internal readiness meter up bit by bit. So even if they're not open to talking about it with you right now in this moment, rest assured that you have planted a seed. And each time you have a conversation with them about it, you're kind of watering that seed. And slowly but surely, you are helping them get closer to making a quit attempt. When you have that ask, advise, refer conversation with a young person, heads up, be prepared to be met with resistance. That is okay. You're not doing anything wrong. And when that happens, just do your best to focus on relationship building. Prove to them that you are a trusted adult who's on their side, you care about them. And if you're familiar with the principles of motivational interviewing, you could use those OARS skills to further your connection. So the OARS skills are open-ended questions, affirmations, reflections, and summarization. Another powerful thing that you can do is to introduce them to other coping strategies and stress management techniques. You can offer to connect them with resources and share some handouts with them. Right? Just put that in your backpack just in case you want to look at it later on. And lastly, if you are able to, be sure to follow up with them. Continue that relationship building and keep asking in a respectful way. One of these days, they will be more receptive to talking with you about it. And when they are ready to talk about quitting, you can help them to make a plan and get ready. We know that preparation is key to any successful journey. So use those OARS skills to explore their motivations to make this change, help them to identify other supportive and trusted people in their lives. Be sure to spend time informing them about the side effects of nicotine withdrawal and share some strategies to help them manage those symptoms, push through those cravings. Talk with them to identify what their personal triggers are, what coping strategies they can try instead, and help them explore some self-care activities. It's also really important for us to help boost their self-efficacy, their belief that they can do hard things. So share lots of affirmations with them, tell them about the strengths that you see within them. And lastly, be sure to connect them with additional resources, including My Life, My Quit and the Maine Quit link. My Life, My Quit is a free confidential program designed to help teens and young adults quit smoking, vaping, or using other tobacco products. It offers a supportive, judgment-free approach. It provides accurate information about the risks of tobacco and nicotine, along with practical tools to help build healthier habits. Participants can work at their own pace through self-guided activities, while also having access to trained coaches via text, phone, or live chat for personalized encouragement and strategies. The program focuses not only on quitting, but also on managing stress in healthy ways, boosting confidence, and empowering them to take control of their health and future. And we also have the Maine Quit link. This is a free statewide program designed to help people who live in Maine quit tobacco and nicotine. This program is for adults age 18 plus. The Maine Quit link offers personalized quit plans, one-on-one coaching with trained quit coaches, as well as access to medications that can reduce cravings. Participants can choose phone, text, or online support, making it easy to find a method that fits into their lifestyle and their preference. By combining expert guidance with proven tools, the Maine Quit link increases the chances of quitting successfully and supports Mainers in building healthier tobacco-free lives. There are several ways to get connected with the Maine Quit link. So somebody could call 1-800-QUIT-NOW. And it's worth noting that this phone number works wherever somebody is in the country. So simply call 1-800-QUIT-NOW. You'll be automatically connected to your state's tobacco quit line. Another way to connect with the Maine Quit link is online through the link shown here on the slide, MaineQuitLink.com. And if you are a provider, you can submit a referral for your patient, your client, whomever you're supporting. As we near the end of this presentation, I do want to quickly highlight the free CTI material database. This is open, accessible to everybody. And here you'll find youth and adult provider toolkits, infographics, fact sheets, patient rack cards, posters to hang in your office, as well as magnets and even stickers. So a lot of goodies in here. I do hope that you'll check that out. And if you enjoyed today's webinar and you want to learn more about tobacco and nicotine treatment, I do encourage you to sign up for another training with us. We have some great ones coming up, which you can browse at ctimaine.org/education. And finally, I just want to remind everybody that we are always here as a resource for you. We welcome your connection with us via website or via email at tobaccotrng@mainehealth.org. And it looks like we have just about 10 minutes left, which is perfect. So at this time, I'd love to open up for questions and comments from the group. And Haley and I will do our best to answer those for you. I'm going to stop sharing just so I can see Haley and Alicia.
Hi there. Thank you so
Hey.
much, Bonnie. Good to see you. Great, informative, engaging presentation. We do have a few questions in the chat, and if there are some or any that we're unable to answer or get to, we certainly will follow up with an email to all who attended. Let's see. Were the rates for EVP quit attempts in the past 30 days or ever?
Let
Yeah.
me, oh, Haley, you can
Yeah,
go, please.
so the rates for EVP quit attempts was actually measured within the past 12 months. So not exactly past 30 days or ever, but within the past year.
Great. Thank you, Haley.
Awesome. Thank you so much. And does Maya's ask questions about race or ethnicity? Does the state look at tobacco use or other substance use in youth and immigrant communities in any way?
Yeah, so Myas asked about race and ethnicity, as well as sexual orientation, gender identity. And actually, in the reports that Bonnie pointed out earlier in the presentation and have the specific page numbers on each question in those detailed reports. The questions are broken down by different variables like race, ethnicity, sexual orientation, gender identity, as well as geographic location. And then we currently don't specifically look at tobacco use with the survey in immigrant communities. We don't currently have a question that would identify if a student is a new Mainer or part of the immigrant community. We currently just look at race and ethnicity.
Great. Thanks so much, Haley.
Yes, thank you, Haley. Okay, and what language is My Life, My Quit available in?
I will need to look into that and get back to you. I know that it's available in several languages, but I can't speak to which those are off the top of my head. But I will pull that together and send that to Alicia to share with the group.
Perfect.
Yeah,
Thank you
great
so much.
question.
Is there any indication in the data that youth are switching to other tobacco products as a means to attempt EVP quits?
Currently, we have not run any analysis that would look deeper into that data. So as of right now, I kind of just have to say we aren't sure.
Okay. Thank you. And just feel free to type your questions into the Q&A box. Um, One other question we may need to get back to them on, can you speak to students and youth who are accessing nicotine products online via social media such as TikTok, Snapchat?
Yeah, currently we don't ask any specific questions on nicotine pouches and where they're accessing it. 2025 was actually the first survey that included nicotine pouches because it's kind of a new product within the past few years that we're aware of that youth is currently using. So it could potentially be a new question in 2025 or for 2027. We're in those early stages of question revision and starting 2027 Maya's prep.
Great. Thank you.
Great.
Great question.
Yes, thank you. Yeah, I think that is all the questions so far. but just want to give a shout out. There was great success in Cumberland County Public Health staff here at South Portland High School weekly. So effective having her do interventions and specifically calling out Selena. So kudos,
Oh,
Selena.
great. We love Selena. She does such great work.
Yes. We have a couple of more minutes, so if there's any other questions, we have Bonnie and Haley here. But I will just share a couple more things. If anyone missed the continuing education pieces at the beginning. So today's session was recorded and it will be posted to our website. To claim CME credits, you must have a Cloud CME profile. Full instructions for that will be included in that post-webinar email I referenced earlier. For those seeking CHES credit, your attendance will be submitted to NCHEC. Um, you will receive a follow-up email containing today's slide deck, excuse me, handouts, and any additional resources that I actually did include in the chat as well. And just a reminder too that once the webinar does end, an evaluation will pop up on the screen, and we do greatly appreciate your feedback. And if you can take a moment to complete that, that would be great. But at any time, you're welcome to reach out to our tobacco training. So tobacco, TRNG, at MaineHealth.org if you have any questions. I don't see any additional. Oh, okay, stop. I need to scroll. Let's see. Does Myas ask about how many youth use fake IDs to purchase tobacco products?
We
Good
currently
question.
do not. We mostly ask, how did you normally or how did you usually get them? So, for example, the electronic vapor products,
Mhm.
it's they bought them themselves in a shop or they got them from a family member. They took them from a store. They bought them from them for themselves online. So we don't currently ask about the methods that they use to be able to purchase.
Mm. Right. So that question that asks that and then they respond, I got it from a store, it's unclear whether they're using a fake ID or they just weren't getting ID'd. Hard to tell from that data.
Excellent. Any last minute questions?
And just while we're waiting for any questions to come through, I do want to acknowledge that was a lot of data, a lot of numbers and percentages and graphs. So I don't expect you to have absorbed every word I said. That you'll have these slides, you have the link to the survey results. So explore those on your own. Take some time to really look through the different topics that are of interest to you. And like Alicia said, if you have any follow-up questions, something that you didn't think of right now in this moment, but you think of something later on, don't hesitate to reach out to us.
Lots of thank yous in the chat, and I will give you a couple minutes back in your day. Thank you so much, Bonnie. Thank you so much, Haley, for joining us today.
Yeah,
Really
thank you,
appreciate
Haley.
the information. All right, take care.
Thanks, everyone. Enjoy the sunshine.
Bye-bye.